Our job is, how do we take care of a community of people? How do we take care of all of our families? Healthcare has gotten a whole lot more complex, and these days it takes a team. We've got a big group in all the primary care specialties, and if you've got a need, we're there to care for you.
We have regular meetings both at the health center and the network level, trying to analyze what we've done well and what we could improve upon.
From what we can see, patients really seem to like this approach. They feel like they have more people behind them. With this team model, we're able to make a change in medications or lifestyle and follow it up a lot faster.
We think that extra attention is what tips the scale to keep folks from more acute settings. Care teams include several members: the physician assistant or nurse practitioner, care manager, as well as behavioral health specialist.
You know, the nice thing about the network is that I always have someone I can go to with a question or concern, and if they don't know the answer, they know who to go to, and that wasn't always the case in private practice, where you didn't have all these people who are experts in their specific divisions.
We want to involve other people, whether that be nursing staff or the psychologists or the social workers or the care managers.
Now that we have this wraparound team, we're all available to the patient, but then we're all available even when the patient's not there to say, I'm really concerned about this case, let's get some ideas, let's figure out what's the best approach. How wonderful that we now have these behavioral health consultants right down the hall, so we can say, hey, can you just come in and have a quick conversation?
Team-based care is important to patients because it allows them to have a number of services met within one specific location. When people are kind of parceled out to different programs, it makes it harder and harder for patients to have collaboration among the providers, but also it's confusing to have these different people from different teams talking about things where you can receive all these services at one place where there's constant communication between providers. And I think it makes it easier for the patients, it makes it easier for the providers as well.
When you come and see your doctor, they can offer you more services right there in one spot, so you don't have to go elsewhere.
That's what's so great about having such a diverse team. It's not on one person's shoulders who only has a couple minutes. They have the support of everybody else who specializes in a variety of things in life, and hopefully that helps us with that whole person approach.
Team-based care is a little different than our traditional methods of approaching behavioral health with patients. In a traditional model, a patient may go see a therapist, but there might not be a whole lot of communication with the primary care provider about what's happening. In those cases, there may not be as much coordination when it comes to medication management or understanding the different therapeutic interventions that are being used. Within the behavioral health role here, we provide a very short-term service, very intervention-focused, solution-focused, trying to help empower our patients to make changes in their lives that they feel they can sustain. And the model allows us to do that in a shorter term model where people don't have to be necessarily seen for 6 months, a year, but they feel like, okay, this is the service that's open to me. I know I can always reach out to my behavioral health consultant if I'm struggling and get reconnected. So it's kind of an open door. Patients aren't ever closed as a case where you might be in a traditional therapy sense. Team-based care provides an opportunity for our patients to receive a number of services within one location and allowing them to access that communication that isn't always open or available in different practices. Within our model, a patient could come in for a primary care visit and express that they're really struggling with something like postpartum depression, something that's not always identified readily enough and is a severe problem in our country. That patient can talk to their doctor, who can then retrieve a behavioral health consultant who can talk to them in that session, get them connected with a service to provide them with the therapy and the support that they need to get through that. By doing that, that decreases the number of primary care visits they're going to have for something that may actually be seen as somatic symptoms.